This is a presentation on healthcare personnel scarcity during a pandemic. And this is by Hillary Reagan and Victoria Burse. So, background pre-pandemic insofar as healthcare personnel and staffing shortages. There was already a precedent of a shortage of healthcare personnel, physicians, nurses, and ancillary staff, including respiratory therapists. According to the 2019 AAMC annual report, there was a projected shortfall of 40,000 to 122,000 over the next decade. So clearly this is going to continue to be an issue in pre-pandemic times even. Shortage of 29,000 to 42,900 doctors in early 2020. Again, that's expected to continue to rise. Contributing factors include the growing U.S. population, aging U.S. population, aging physician and nurse population, and the retirements that accompany aging. Increase in chronic diseases requires more healthcare personnel, so the demand increases as chronic disease continues to increase. So again, this is going to continue to be an issue whether in pandemic times or non-pandemic times. When COVID-19 hit, it exacerbated the scarcity of healthcare workers that already existed. More than 1,000 hospitals in the U.S. Critically short-staffed as of the fall of 2020, so right in the thick of COVID-19. Spans all 50 states, so there is no state that has been spared. It certainly has increased the use of travel and per diem nurses, which are not cost-effective, nor is it a consistent way to staff. The Bureau of Labor Statistics forecasts a national shortfall of 176,000 nurses per year through 2029. So in some way we've got to figure out not only how to staff during times of crisis, but we'll leave the shortage, the chronic shortage of nurses and doctors for another discussion, but there are reasons for that. If we consider that we have nursing healthcare shortages during non-pandemic times and the scarcity is forecast to continue and indeed grow, then we've got to understand the supply and demand as well as variables that contribute to the relationship. Supply and demand is a pretty simple model. It assumes that the perfect market assumes that the relationship between supply and demand will dictate a perfect balancing point, wherein the market will provide exactly the quantity that the market demands due to the right or equilibrium price. The problem is, of course, that healthcare demand is not static in the best of times, and certainly highly vulnerable to extrinsic variables. In the worst of times, the demand is totally unpredictable, such as the case in a pandemic or an event that creates mass demand across numerous markets. In regards to labor, the quantity of supply is thought to be a function of the relationship between wages and labor supply, i.e., the more wages go up, the greater your labor pool. The issue, however, is that not only will demands for labor change, but a large event like a pandemic creates a demand that requires a short-term major supply conundrum. Labor supply is supposed to slope upward, meaning that the higher the wages, the more attractive the position, and thus the more labor supply workers you will have. Meaning that workers will be attracted to well-paying positions, and so therefore the market will correct itself insofar as you will have the labor that you need because the wages will be commensurate with what workers want. So though this may be true, though perhaps a bit questionable, in a typical labor market and may provide an equilibrium of labor, it doesn't solve the problem for short-term intense and atypical demand. One of the hard lessons that we've learned and discovered during COVID-19 is that there are certain professionals that are especially required during respiratory pandemic, notably respiratory therapists and ICU RNs. The CDC
And many infectious disease experts agree that this is not the last pandemic that we will ever face as a country or as worldwide. So certainly it's something that we need to continue to prepare and plan for. So though we know that we have shortages in non-pandemic times already with these personnel, perhaps we can apply this lesson and consider leveraging skill sets with an eye towards cross-training personnel. What does cross-training mean? It means expanding your skill sets so that personnel can go where they are most needed, offers greater flexibility in times of crisis, i.e. a pandemic. More professionals are equipped to handle patients with respiratory issues, with a surge in patients with respiratory problems due to COVID-19 or any other respiratory pandemic, and certainly it will result in better preparedness for future problems. The idea, of course, is to increase elasticity within your labor pool. The more elasticity you have, the better off for everyone, certainly the better off for the firm itself, but most importantly, probably better off for patients and society as a whole. In order to achieve the same level of output and perhaps increase output or at least increase flexibility, cross-training would create elasticity and benefit the system by having some available substitution built into it. We believe that healthcare economics is incredibly important, looking at healthcare as a whole. We believe that healthcare economics needs to exist simply because the traditional economic theories and analysis, as well as lenses, don't always apply to healthcare. Because healthcare, its inputs and outputs, do not follow the laws of a perfect market, it is important to consider the nuances of healthcare economics, its analysis of health or medical care, and really look at healthcare and decide whether or not it's a commodity versus a public good, and look at the ways that we can change and tweak healthcare, specifically in this case the personnel itself, in order to create a better public good. Thank you.